We're about to go live with Dr. McMahon from Hello Ralphie. She's one of the veterinarians over there, and we're going to be talking all things dog anxiety. I know with the 4th of July right around the corner, we've had a lot of questions from the community around what are we going to do with our dogs this weekend when they're freaking out with all the noises and whatnot. So we're going to answer all of the questions that we've received throughout the week from our community. I have them here. And then, hi guys. Those of you just joining, if you do have questions around dog anxiety, what to do, what types of things you can do to help your dog this weekend during the 4th, please drop them in the chat, and I'm going to invite Dr. McMahon right now, and she's going to answer all our questions. Thank you all for being here, and thanks everyone who sent in their anxiety questions. We have them all, and don't worry, we'll get to all of them. Hi, Tony. Any questions? Oh, hey. Hi.
Hi. Sorry, guys.
How are you?
Hi, I'm Dr. McMahon. So,
thanks for joining.
How fun.
I was just telling everybody that's joining now, we have a ton of questions for you around anxiety and how we can help our dogs this 4th of July. So I'd love to get right to the questions, but first, do you want to do a quick intro and let us know, your background in the industry and just tell us a little bit about yourself, and then we'll get into the questions.
So I went to the University of Pennsylvania, moved up to Boston, decided to move back to Philadelphia. So now I'm a general practitioner in Philly. So basically I just see dogs and cats, and this time of year, all we talk about is anxiety. It's basically every single wellness appointment. We also sprinkle in a little anxiety, especially separation anxiety right now with COVID. That's been fun. And now with 4th of July, we have fireworks. So everything's been very exciting for everyone. A little extra stress for mom and dad.
Yep. And you have 3 cats of your own, right?
Oh, I have 3 cats. They'll probably show up at some point. And I'm babysitting a dog today, so he may bark in the background. So we'll see what happens.
Awesome. Okay, so I know you mentioned separation anxiety, and then we talked about 4th of July right on the corner. So I want to start off with my favorite question that I got earlier this week. I don't know who it's from. They dropped it in my story, but I think it's a good starting point. It says, quote, "Why won't he just lay down and relax?" End quote. So before we go into that, that's like a very general statement, but I can relate. Like, why won't they just relax? So I want to take it back and ask you, will you maybe explain a little bit more about the different types of anxiety? Because there's so many reasons why the dog wouldn't lay down and relax, right? So it can go down that route a little bit and kind of talk about.
So same as people, we all got our own issues. And so every pet has their own mental issues that they're working through as well. So some of them, like genetics, has done them dirty. So there are genetic links that some parents, especially in like the Doodles, the Wheatons, that the German Shepherds, it kind of comes with the territory in a lot of these breeds that they'll have some anxiety. So getting on it early and often is going to be very helpful in life. And then a lot of my older pups will start to get more anxiety as they're getting older because they're getting more painful. So having a bunch of different factors with that. So when you're thinking about anxiety, you're wondering, is it an environmental issue? Is it a neurochemical issue? Is it a pain issue or some other underlying disease? So if you've ever had anxiety yourself, the first thing your doctor will test you for blood-wise is hyperthyroidism. So this is more of a cat issue, but number one symptom of that is your thyroid's going too fast, your brain's going too fast. So you got so much anxiety. So that's one reason. We don't see as many of that in dogs, which is nice for us. So then we have have we learned, what has our us about the world, and what have we become triggered into thinking and that we cannot relax about. So same as people, figuring out what our triggers are and then working on those. So behavior therapy is huge regardless of the problem. So same reason we go to therapy. Dogs need their training. And then when we need, using supplements and drugs to help out to get you back down to ready to focus in on issues is very helpful.
So for those
that answer
that you speak of, would that fall under like the situational anxiety, and would that be like the noises and
pretty much anything can cause anxiety. So like the fire alarm is a noise reactive thing. So like that's going to cause anxiety. Knocking on the door, that's a triggering noise issue. Thunderstorms, lightning, fireworks, all of those are very loud set of noises that we have no ability to predict, and so it's very stressful. So that's something, and then once they start to predict it, it gets way worse. So then other things that might be stressful is when the environment changes. So moving is very stressful, so that will cause some anxiety. People start packing up their boxes, their whole worlds are changing, and that just ruins their day. When you leave the house because you're changing your routine, they've grown really attached to you, that's an issue. When new people come into the house, you're changing their routine, you're changing what they perceive as normal in life, that's stressful. So pretty much anything outside of what they perceive to be the normal, and their perception is not our perception most of the time, can be stressful and then cause extra anxiety.
So when
So
this
anything.
when this pet parent asks
Mm-hmm.
about why won't he just lay down and relax, it's going to be kind of it's going to be kind of like an
So
experiment.
many issues, so many things. So if they're older, we got the ability, or we have the additional problem of, can they not relax because their joints hurt and they're just wandering around because their joints hurt and they don't feel comfortable enough to lie down, which is why talking to your vet is important, because if that is part of the problem, like once we're getting over 5, I'm starting to consider, like, do we need pain meds in addition to anxiety meds to help them feel more comfortable to be able to settle down? Or like, we just have to figure out what is stressing them out, and if we can take away that stimulus or train them to get used to that stimulus, which is a really big thing. Love positive reinforcement treatment, or training. So one big strategy is just giving them treats. If they'll pay attention to you and you can just give them treats to the point that they're not paying attention to what's going on, they can maybe settle down, and then you can kind of build off of that. So, but it's a big if, because not everyone is ready to pay attention to you when they're stressed out.
Of course. Okay. I like how you tackled that one. And so, for anyone just joining, we are answering questions around anxiety, situational,
Yeah, anything.
any type, anything you have questions around the 4th of July. So drop them in the chat. We're going through the questions that we collected earlier from the community. So I do want to get to Jindo Lab Nico, who I saw joined earlier. They're asking, what do you give / is CBD safe to use in a 17-week-old puppy who's scared of fireworks? So maybe we can talk about some
You
tactics.
gotta talk to your vet. 17 weeks is so young. That's so young. We need a lot of training. So at that age, I would jump way over supplements. No offense to CBD, but I would, at 17 weeks, go talk to your vet and talk to a trainer, because that is a huge developmental stage. And if we're really freaking out, we want to get them calm now so that way they can be calm in the future, because we learn now to freak out. And so once we start freaking out, we build on that and we build on that until we're a terrible mess and we're ripping through dollars. So I don't want that for you. So I want you to find a local trainer, find a vet, and then try and sleep through the next thunderstorms, because that is high issue. When we're older and we're slowly starting to develop these problems, then I think supplements have a place in this. So in my world, there's like a theory that if you need to adjust behaviors about 25%, then supplements have a place. So say we are pacing, but we're able to settle down after a lot of, like, hey, let's chill out, come on. But eventually we're able to chill out. Supplements have their place there because we're not yet super out of it. If we are, we are tearing apart the house, we need some drugs to get back down to able to concentrate on what you're asking.
Mm-hmm. Got it. But when they're so far gone, you probably want to build on top of behavior. So
you will, So at 17 weeks, so that answer is mostly because we're 17 weeks old. Right. And my puppies, I take everything so much more seriously because they are babies and I want to nurture their tiny little brains into being brave little babies in the future. So I would take it really seriously, work with your vet, work with your local trainer, and get on top of it. So that way in the future, supplements are a reasonable option and you're not having to use a bunch of bigger guns.
Love it. Okay, great answer. And we have this recorded, so Jindo and Nico, if you get that, we'll make sure you do. Okay, so the next one's from Scout the Mini Aussie, and going on to dogs that maybe are older, and are allowed to use supplements and other meds. So
Mm-hmm.
the question says, is it safe to use CBD with other anxiety medicines such as trazodone?
Trazodone, yeah, trazodone is a really common one. Most patients handle it pretty darn well. Um, and there really shouldn't, they don't work on the same receptors. So a lot of things point to yes. That being said, CBD is a tricky thing in that it's very legally tricky for us to get research on it. So the CBD is technically a controlled substance federally. So every state is doing their own thing. So federally, though, vets' licenses are connected to the federal level. So very few vets have very good research, but anecdotal research at this point. And good news is usually it's pretty safe. But I would talk to your own vet in your own state because every state also has different rules about what's allowed. So that's a pretty like tricky question. That being said, more research is coming out like constantly. So a new study should be coming out about what's good with CBD pretty soon and what doses to do. So we still don't have like concrete numbers on that for the vet world of like what is like like prescription based like numbers. But hopefully soon we'll have some better answers. But in theory,
Yeah.
they shouldn't work on the same receptors, and every dog acts differently, so it's hard to know.
Awesome. Yes. I mean, on that note, with dosing, it's always case by case. We always like dogs, talk to your vet and also reach out to us and ask questions about, what might be right for your dog. But it's really a trial and error process sometimes, figuring out, just like us,
Everyone's different. We're all special little flowers.
So how would you know if your dog's struggling with anxiety or if it's just a one-off thing? Oh, hi, we saw one of the
This was one. This is Emmy. She's really important.
Hi.
So to know that your pet's anxious, there's a bunch of different reasons you might be anxious or you might show symptoms. So, pacing, very common, barking, not being able to settle, like, why won't my dog lie down? Usually anxiety, unless there's like some other illness. And so when we work on anxiety, unfortunately, it's a diagnosis of exclusion because they're not telling us like, yeah, I just feel really upset. They're just showing us symptoms that can be really vague. So we need to rule out like, are we vomiting because we're sick or because we're stressed? Are we pacing because our joints are painful or because we're stressed? Are we peeing in the house and pooping in the house because we have like a disease? Or are we stressed? So it's a really tricky thing of like ruling out everything else, but symptoms range from not being able to settle to pooping everywhere to peeing in your plants to breaking through your house to much simpler things like much less dramatic of like constantly pawing at you, not being able to leave your side, like in your body. Yep. And then even like when we start to get aggressive, is that because we're really anxious and we have like a fear related anxiety or anxiety that shows up as like a reactivity towards people? So that's another thing to think about.
Okay, so I just checked off like 90% of those things with which I see in my dog. So once you've talked about that, ruled out the fact that your dog isn't suffering from a more serious medical issue that is in fact anxiety that they're struggling with, what do you put in place daily once what do you do to kind of help guide them on the right? What would you do this week?
First thing is talk to a trainer, because if you can get everything fixed by just like a little mental health therapy, awesome. Usually by the time we're noticing these things, they're farther than just training, but training is always a factor. Then if we have mild symptoms, so again, the 25% rule, I can get away with supplements. So maybe we can try some supplements and see if that helps. If we are really destructive or really reactive, if we are over the edge or just like it's getting to the point where my clients come to me and they're like, I don't know what to do. Both of us are losing sleep over this, me and my pet, and we're not well. Then we need to start with meds and then add supplements from there. So usually what I'll do is because once it's greater than 25%, if we need like 50%, I just need to get their brain to come back to reality and focus in on us so that way we can work on other things. So I'll start with some long-term medications. Everyone's different. So does it work for everyone? No. So I'll start with certain things based on what we're talking about, based on cost. And then there's a lot of cool supplements in the world now, so we can work on some supplements. And then whatever we can do to get my patient back to us so we can focus up on some things, that's what we'll do. And then once we can focus up, we'll work on training and like cognitive behavior training to redirect some of these behaviors or lessen how stressful certain situations are, like noises, for instance, like when someone knocks on the door or fireworks are happening. Fireworks are a hard one to control because that's your neighbor's fault, not yours. But say like there's construction, so getting them to a quiet space, turning on the music, letting them choose a nice environment that they like. So if they have a crate, leave that door open so they can go in it. If they love the bathroom, leave that door open, let them be there. You are absolutely welcome to like work with them, pet them, play with them, to be your calming source. But unfortunately that alone is not enough to like work out of this behavior. So it helps, but it's not statistically proven to like make the big difference. So using that with the calming space, treats, if your dog is treat motivated, which there's a behavior that says like every dog is treat motivated as long as you can get their attention, like they survive somehow, they're eating. So it's just getting a matter of getting them back to a stable level of like, yeah, I can focus on you. So figuring that out and just really a lot of positive reinforcement training of like, yes, you're doing it, you're just sitting here and you're not freaking out, and that is enough for me and I'm happy with that.
Yeah, I would be happy with that. Okay, so for that's just joining or not sure what we're talking about, we are answering everyone's questions on dog anxiety. So if you have anything more specific that you want to go into about, you know, maybe your dog's afraid of the noise of the fireworks coming up this weekend, we've answered some from the community, but just drop them in the chat and we'll get into them. I'm going to ask a personal one about our dog Zoe. You mentioned like, you know, giving them the safe space, trying to get them, you know, away from the fireworks. But if they're in the house and the fireworks are going,
close the blinds, like close the window so it takes down the noise. It's not going to make all the difference, but it's something. All right, continue them.
Yeah, no. So say we locked it down because I'm like, you know, followed all the steps, but she still hears it. Is it? And I always say it's okay. And so I'm always trying to like coddle and settle her. And then my partner, Michael, is like, you know, you don't want
you
to
can.
You're going to,
it's not going to make a difference. So you can coddle her or you cannot coddle her, but for your heart, you're going to want to coddle her. It's not going to make a difference either way. So you go ahead and coddle her.
Okay. So it's not going to make her more freaked, as long as I'm not like, oh my God, fireworks.
Yeah. As long as you're not sprinting around too, I think we'll be okay. But if you are, then your partner's going to need to sedate you as well. And then we'll work from there.
Right. Then we both need to be on something.
Yeah, exactly. So totally okay to coddle her. Bring some treats, hang out, play with toys, have like a little bonding moment in the bathroom, trying to pretend that that's not happening outside. And that should be a good starting point for you.
Awesome. Thank you. Well, I think we've covered a lot. And if no one else has any more questions, did you want to cover anything? I think we covered a lot, but let me know if we missed anything on your end for tips.
Mostly it's treats. We love treats. We love positive. If it's not treats, it's toys. If it's not toys, it's just words of affirmations that they think are nice, which are just high-pitched words of anything. So take time to like just be with them, care for them. Anxiety sucks. There's really no shortcuts, unfortunately. It's like a long process, same as people. Like it's just a long, cruddy process of baby steps until you get to a place that's manageable. So just like stay with it.
Don't give up. These dogs
don't give up.
Awesome. Well, thank you so much, Dr. McMahon. I really loved hearing your, I think you have a lot of knowledge, and thank you to Hello Ralphie for sharing you with us. I really appreciate it. And if anyone has more questions, feel free to continue reaching out. We're always in touch with you guys, and we're going to go live next month about something else. So we're always here for your questions. Thank you so much again. Appreciate it.
All right. Bye.
Bye.